All righty. Well, I am super excited to chat with today's guest, who is a return guest, as we are going to talk about how to optimize eye health. So, I have Dr. Rani Banik, who just released a new book called Beyond Carrots, and it's a excellent book. I have read the book, and so I'm going to dive into her bio. I did interview her in a previous episode, but for those who didn't listen to that, I'm going to go through her bio again, and then we will talk about eye health. So Dr. Rani Banik is America's integrative eye doctor. She is a board certified ophthalmologist and fellowship trained neuro ophthalmologist with additional training in integrative and functional medicine. So Dr. Rani focuses on the root cause of eye diseases and uses integrative strategies for conditions such as dry eye, thyroid eye disease, macular degeneration, cataracts, glaucoma, and other autoimmune diseases of the visual system. She also has a special interest in migraine with visual symptoms, multiple sclerosis, and eye stroke. Her treatments are based on nutrition, botanicals, lifestyle modification, essential oils, and supplements. And thank you for joining us again, Dr. Rani.
Thank you so much, Dr. Eric, for having me back. It's really a pleasure to be here.
Yeah, it's great to chat with you again, and really excited about the release of your book. And so, why did you feel the need to write your new book? I mean, what I know we spoke about it I think this has been in the making for a few years, I think, right? Because I know we
It
spoke about it
has,
last year
yes.
off the record about coming, but why did you feel like you had to get this book out into the world?
Well, a few reasons. I work directly with patients. I have a brick and mortar private practice in New York, but in that practice, I can only reach a certain number of people. And I really wanted to get this information out to a broader audience. And not just the people who are coming in with known eye issues, but people who may be worried about their eyes and they really don't know where to turn for guidance, or perhaps their parents who are worried about their children's eye health, or perhaps their children of older parents who are now experiencing issues like macular degeneration or glaucoma or cataracts, and they're looking for more natural solutions. So the first reason is because I wanted to reach a bigger audience. The second reason is because a lot of my colleagues in the eye care space don't know about nutrition. So, for example, myself going through medical school, I only had about 4 hours of official nutrition training. And in that 4 hours, I remember learning about carbohydrates and proteins and fats, so macronutrients, and basically vitamin C and scurvy. If you don't have enough vitamin C, you can develop scurvy. But that was the extent of my nutrition education. And I was never taught nutrition anytime during my internship, during my residency, during my fellowship, or afterwards. It was only until I trained in functional medicine that I really began to understand the impact of nutrition. So I wanted to get this information out to my colleagues, both ophthalmologists and optometrists, so that they can learn, but then also they can share this information and counsel their patients about nutrition as well.
All right. And as you know, a lot of people listening to this have Graves' disease, and a number of them have thyroid eye disease. But the good news about this book is that it's not just targeted towards any specific eye condition. So, really, anyone can benefit from this condition. Just is it safe to say not only those looking to prevent conditions such as macular degeneration and cataracts, but even those who currently have those eye conditions could also benefit from reading this
Yeah,
book?
absolutely. It doesn't matter where you are in the spectrum of your eye health. What you can learn from this book will benefit you, whether it's now, in the future. There are some things that can also be reversed. Not everything in terms of eye issues, but some things that can be reversed using the power of nutrition. So it is really applicable to anyone in their eye health journey, but also for the entire age range. So from children to adults and older adults can really benefit. So that's really how I wrote it, was to be very broad and to give people the foundations for what they need to include in their diet, to think about how to think about nutrition for eye health.
Okay, so can you talk about in your book you mentioned the three categories of eye nutrients. I'd like to if you can talk about those three categories?
Sure. So I'll just preface this by saying the eye is very complex. And even though it's a small organ, it's about the size of a golf ball, it has over 40 different parts. And each of those different parts have certain nutritional needs, requirements. And so when I categorize the three classes of nutrients, I kind of thought about, okay, what can go wrong in terms of the metabolism of those different eye health parts, and how can we support that? And so the three categories are mitochondrial nutrients, so nutrients to support energy production and mitochondrial health, because the eye is very metabolically active. Even though it's so small, it consumes a tremendous amount of energy. Then the second category of nutrients are antioxidant nutrients, because so many types of eye disease are linked to oxidative stress, whether it be cataracts, glaucoma, macular degeneration. All three of these main eye conditions are linked to oxidative stress. And then finally, the third category of nutrients are anti-inflammatory nutrients. So many, again, chronic types of eye diseases, there is a component of inflammation involved, not just the autoimmune eye conditions like thyroid eye disease, or you talked earlier about multiple sclerosis, autoimmune conditions like that, but other eye conditions also typically have some inflammatory component to them.
Okay, so the three categories, just to repeat, you said mitochondria, antioxidants, and then anti-inflammatory.
Yes, yeah. And the good news is that, in my book, I list out what all the nutrients are. And it's kind of overwhelming if you first look at it, because it's not just one or two nutrients. There's over 30 nutrients we need to get in our diet to help support our eyes. But in terms of those three categories, there's a lot of overlap. So what you're taking to support your mitochondrial health may also help provide antioxidant protection for your eyes. And also what you're taking as an antioxidant can sometimes also overlap with the anti-inflammatory category. So the good news is, yes, there are 30 nutrients altogether, or probably over 30, but there's a lot of duplication, a lot of overlap in terms of the benefits of these nutrients.
Yeah, and I'm not gonna have you go over all the nutrients because they could just read your book for that. But can you talk about some of the more common nutrients, maybe starting with like those that help with oxidative stress, maybe two or three, or however many you want to list that could
Yeah,
help with.
sure. So we typically think of antioxidants as vitamin C, vitamin E, vitamin A. Those are the typical, or glutathione is the one that gets talked about a lot as well. These are all really important antioxidants for our body and also for our eyes. But specific to the eye, there are three antioxidants that really many people may have not heard of, that are really super important. And these three are what we call the macular carotenoids. And you may have seen them, maybe listed in a supplement, or, maybe it's been talked about for other issues like brain health. But for eye health, these three antioxidants are, I would say, the most important. And they have fancy names. They're called lutein, zeaxanthin, and mesozeaxanthin. And these are what we call macular carotenoids because they're deposited. First of all, our body can't make any of these three nutrients. We need to get it from an outside source, whether it's coming from our diet or whether you take a supplement. But our body takes these nutrients, these antioxidants, and selectively deposits them in the retina. So they get deposited in the retina, and these nutrients, they have like a yellowish color to them. So when we look in the back of the eye, we can actually see like a yellow pigment in the retina, which are reflective of these, or representative of these nutrients in the eye. And they serve as our eye's internal, this is really incredible, our internal sunglasses and our internal blue blockers. So if you're going to choose, okay, I'm going to focus on these, antioxidant nutrients for my eye health, you need to make sure that you're getting lutein and zeaxanthin in your diet. Now, mesozeaxanthin is harder to come by from diet alone. There are some marine species that provide mesozeaxanthin, but in small amounts. So most of the mesozeaxanthin in our eye gets, we think, converted from lutein into mesozeaxanthin. So have enough lutein in your diet, have enough zeaxanthin in your diet. And I would say that's probably the most overlooked, antioxidant protection that people don't realize.
And then, so just briefly bring up thyroid eye disease because oxidative stress also plays a role in that. But I don't think those nutrients are really mentioned, at least in relation to thyroid eye disease. So, not to say they can help. I guess you could elaborate on that. But one of the nutrients that's mentioned the most when it comes to thyroid eye disease is selenium. So, would you say selenium, which of course is a mineral, is that something that I would imagine it's not just for thyroid. I mean, obviously, it's not just for thyroid eye disease, but when it comes to other eye conditions, can selenium also be beneficial for like macular degeneration, cataracts?
So the studies haven't been done looking specifically at selenium for those types of eye conditions, but what I'll tell you is that not only is selenium an antioxidant, it's actually very important for mitochondrial function also. So you have that overlap there. So if you're taking, a good amount of selenium in your diet, maybe you're having some Brazil nuts every day, or maybe you're taking a supplement, that will also improve your mitochondria's ability to produce energy. So you're helping that as well. And absolutely for thyroid eye disease, I recommend selenium to all of my patients. And there are studies to back that up, in terms of the benefits for thyroid eye disease. So I think it is really important. Now, just be careful because you can overdose on selenium. So you want to just be careful in terms of your dietary intake. I don't know, Dr. Eric, what you recommend, but I usually recommend no more than um, 3, maybe at the max 4 Brazil nuts a day, maybe even just 2. But be careful with your selenium intake.
Yeah, I agree. Definitely don't want to overdo it with selenium, taking too much. Yeah, especially in supplement form. It's interesting with the Brazil nuts. Uh, I mean, I haven't heard of a Brazil nut toxicity, but I would agree. I never tell someone, yeah, just eat unlimited amount of Brazil nuts. I would say if you're going to rely on the Brazil nuts, it it also depends because every Brazil nut's going to be different, unlike a supplement
Mhm.
where a certain supplement has 200 micrograms. But either way, yeah, definitely want to be cautious about getting too much selenium. So, what are bioflavonoids? And of course, I'm bringing this up because you talk about it in your book. So, what are bioflavonoids? And then if you could talk about some of the more important ones for eye health.
Yeah, so bioflavonoids come from plants and they're very potent antioxidant nutrients. The plants develop these chemical compounds to protect themselves against disease, against invasive bacteria or other species. So they're the plant's natural protective defense. So if we eat plants that have bioflavonoids in them, then that defense gets conferred to us also. And bioflavonoids, there's so many out there. I think they've identified at least 4,000 different bioflavonoids that come from different plants. But the ones I would say are most important for our eyes, the ones that have been studied and that have been shown to benefit, include quercetin. So quercetin, you may have heard of this, especially because it's also great for immune health. So kind of, quercetin got talked about a lot during the pandemic as a great kind of immune boosting supplement. But quercetin really has been shown to help the retina for conditions like macular degeneration. Also, resveratrol is a potent bioflavonoid, which has been shown to help with optic nerve issues as well as retinal issues. And then there's epigallocatechin 3 gallate, which is EGCG, which comes from green tea. And so EGCG is, again, a very potent bioflavonoid. It's been shown to be helpful, again, for optic nerve health as well as retinal health. So these are all plant-based or plant-derived compounds. And what I tell my patients is try to include a diversity of plants in your diet to try to get a lot of these bioflavonoids into your system. And it's not that you have to be plant-based in your style of eating, but be plant-rich. So have a diversity of different colors to provide you with these bioflavonoids, not just the same, if you're eating a leafy green, not just the same leafy green every day, but cycle through the different shades of greens, different shades of purples and blacks, and blues and reds and yellows and oranges, and you will naturally provide your body and your eyes with all of these bioflavonoids. Another class of bioflavonoids that's really important are the anthocyanins. And you may have heard of these before, but they're pigmented compounds, very richly found in berries. So that's another great eye health food that I recommend to my patients is have colorful berries in your diet, and you'll be providing your body and your eyes with these powerful antioxidants. So blackberries, blueberries, even strawberries and raspberries, goji berries, all good for your eyes.
All right, wonderful. So yeah, definitely agree. You want to do as much as you can through diet, and very important to diversify. Leaky eye syndrome. So you talk about leaky eye syndrome, which I'm thinking a good number of people listening to this probably have not heard of leaky eye syndrome. Most of us have heard of leaky gut syndrome. There's even leaky brain syndrome, having a leaky brain, disruption of the blood-brain barrier. But what is leaky eye syndrome, and how can this be prevented and or healed?
Yeah, so leaky eye is actually a term that I came up with. That's probably why you haven't heard of it before, but I introduced it in my book. And, as I was learning, as I was doing my training in functional medicine, I, like you, learned about leaky gut and leaky brain and leaky heart and leaky skin. And I was thinking, oh my goodness, we have leaky eye, as a disease as well, but it just never gets talked about. So what is leaky eye? Well, it's not a single type of eye issue. It's a type of I would say a category of retinal disease in which the blood vessels become damaged, and then blood and protein and fluid leaks out from blood vessels into the retina where it's not supposed to be. So basically, it's because there's damage to the blood vessel and then inflammation that causes leaky eye. So the prototypical leaky eye syndrome is macular degeneration. Um, what happens in macular degeneration is that there's oxidative stress in the retina, there's waste products that develop, and then those waste products trigger inflammation that leads to leaking of blood vessels. And if you may have heard of macular degeneration, there's two types, there's dry and there's wet. Well, dry is not leaky eye, but when it converts into wet, that's basically leaky eye syndrome, where blood leaks out and then people can lose a tremendous amount of vision. Particularly their central vision gets affected. So they can have a big blind spot right in the middle of their vision where they can't see faces, they can't read, they can't drive, and it's because of leaking of blood and protein and fluids. Another example of leaky eye syndrome is diabetic retinopathy. So a similar process happens in diabetes where the capillaries, the very small capillaries in the retina, become damaged from high glucose levels. Basically, there's advanced glycation end products or agents that cause damage to the blood vessels, and the blood vessels start to leak, and then people can lose vision. So these are some examples of leaky eye syndrome. It's not just a single type of eye issue. It's kind of a category of multiple eye issues due to oxidative stress and then inflammation.
Okay, so if someone has wet macular degeneration, then it sounds like they almost definitely have leaky eye syndrome, and that's
Yes, by
worse
my
than the.
definition, it's leaky eye because it's progressed into that stage where blood is leaking where it should not be leaking. And then it's leaking right under the central part of our vision, which causes the vision loss and blindness. So yeah, it's an interesting concept, and we'll see how my colleagues in ophthalmology and optometry respond to it. But I did think it was important to point out because there's a similar in the similar vein of leaky gut, basically, if you have damage to the lining of structures, whether it be your gut lining or your blood vessel lining, then you're going to have, proteins, fluids, other compounds that leak into areas where they're not supposed to be. And then that triggers inflammation as well.
All right, well, thank you for sharing that. And are there any other nutrients? Again, I know there are other nutrients because you have them in the book, but any that you have a burning desire to talk about when it comes to eye health?
Yeah, I would say the omegas are really another important class of nutrients aside from the macular carotenoids. And why are the omegas so important? Well, our retina, the light sensing tissue in the back of our eye, the majority of our retina is made out of an omega 3 called DHA. And actually, the brain is also made out of DHA. Much of the brain is made out of DHA. So the highest concentrations of DHA in the body are in the brain and in the eye. And in the eye, we need a constant supply of this omega-3 DHA because the retinal cells are constantly turning over. There's a high turnover, high metabolic rate. Whenever our cells capture light, they basically lose their cell membranes, and then they have to remake their cell membranes. And DHA is the critical structural component of the cell membrane. So have enough omega-3s in your diet, preferably a combination of DHA and EPA. If you're vegan or vegetarian, you can do ALA, which is a precursor, but unfortunately, much of it does not get converted into DHA and EPA. So you can take a supplement. And then there's an omega-6 that's also been shown to be beneficial for eye health. So we typically think of omega-6s as, oh, those are the not good omegas. Those are the pro-inflammatory omegas. But there's a type of omega-6 called GLA, gamma linolenic acid, which has been shown to be actually anti-inflammatory, and it can help conditions like dry eye. So relating it kind of back to thyroid and thyroid eye disease, if you do have thyroid eye disease, one of the most common symptoms is dry eye. So, think about increasing your intake of omega-3s and perhaps take an omega-6 as a supplement, a GLA supplement, to help with your dry eye.
So with GLA, like if someone's going to take it in supplement form, like borage oil or evening primrose oil, for
Yeah,
example.
exactly. Yeah, it's hard to get it from diet. I don't think that many foods have a lot of GLA, maybe small amounts, in some nuts and so forth. But if you're really, suffering from dry eye, I would suggest taking a supplement. And now there are great combination supplements that you can take, where it's a combination of omega-3 and 6, and sometimes even 7 and 9 can also be beneficial. But always check with your doctor first before you decide to take a supplement.
And getting back to omega-3s, if someone is, let's say, if they're eating fish once a week, do you think everybody, of course, is different, but in that case, would you say, well, that should be sufficient to have enough EPA, DHA, or it's not sufficient if you're eating it only once a week and you should take a supplement, or do you recommend like a fatty acid profile to see if they're deficient?
Yeah, so the studies, I'll just reference the Women's Health Initiative, which looked at thousands of women, and they looked at their incidence of dry eye. And what the study found was that the women who had regular fish intake of 2 to 3 times a week had much lower frequency of their dry eye symptoms. So 2 to 3 times a week is kind of the overall recommendation that we make for conditions like both dry eye as well as macular degeneration. So similar to dry eye, other studies have shown that people who have higher fish intakes per week have less prevalence of macular degeneration as well. So it can benefit multiple things in terms of your eye health. Now, I would just be cautious. You want to, if you're eating fish a couple of times a week, make sure that it's wild caught, that it has a low mercury profile. So you just have to be cautious with that because you don't want to have, high mercury fish and have mercury toxicity. But if you're not sure, let's say you don't know, oh, am I getting enough omegas? What should I do? Should I supplement, or am I getting enough from my diet? You can do an omega quant test. It's basically like a dried spot blood test that will tell you what your omega profile is. And then you can adjust your dietary intake or supplement intake based off of that omega quant test. It's very easy to do.
Yeah, I'm familiar with that test. I actually have done that myself.
Mhm.
And yeah, I find that to be helpful. So yeah,
Yeah.
appreciate you
And what I would
sharing
say
that.
is, just going back to the omega-6, not all omega-6s are harmful. We definitely need omega-6 in our body, but it's really the ratio that you're looking for. So if you have a really high intake of 6 and very little 3, that's going to push your body into a more pro-inflammatory state. Versus if you have a higher level of 3, more, equal to the 6s, that's going to be a better balance for your body. So try to strive for that, more of a balance. You don't want to completely eliminate omega-6, but try to get that balance.
With getting back to thyroid eye disease, we spoke about selenium. Are there any other nutrients that you find to be beneficial? I mean, omegas also could benefit people with thyroid eye disease, not just the other. I mean, just for overall eye health. But
Yeah.
anything else besides the omegas and selenium?
Yeah, so there's a couple of other nutrients to really think about and maybe test for and see if you're deficient in it and supplement if you need to. Vitamin D is the one that is the most I've noticed in my thyroid patients, both hyperthyroid as well as hypothyroid. So whether you're Graves or Hashimoto's, I found that vitamin D levels tend to be very low, and I always test for it because I would like to know where my patients are to see, if I do need to prescribe them a supplement, which supplement should I prescribe them? So the typical range that's reported in labs is, the normal range will be somewhere between 30 to 50 or so. But I would say, if you're on the low end, you want to boost your vitamin D level because it's also vitamin D is not just a vitamin. It actually functions like a hormone. It's really important for so many processes in the body, including thyroid health. It's also anti-inflammatory. So you want to boost your vitamin D levels. I tell my patients, try to get them into the 50 to 70 range. And I wouldn't go above 70 because then it may cause other issues. But 50 to 70 is what I tend to target my patients for. So you want to eat foods that are maybe fortified with vitamin D or perhaps take a vitamin D supplement. Now, in my book, I talk about, all the different sources of some of these nutrients. And something I think a lot of people don't realize is that mushrooms are a great source of vitamin D. So if you enjoy mushrooms, they have other health benefits as well, some anti-cancer properties, but you can also help boost your vitamin D level through that. And then another nutrient I would say that's really important, we talked about selenium as a mineral, but iron is also important. So you want to get your iron levels checked. And if your iron levels are low, considering eating more foods rich in iron, but also perhaps taking a supplement as well, because we do need iron in the process of, just thyroid hormone formation and overall thyroid health.
Yep, iron is one of those things you don't want. Kind of like selenium, you don't want too
Yes.
low, but you also don't want too high. You don't want iron overload. So I definitely recommend testing for doing like an iron panel. Unfortunately, some medical doctors rely just on a CBC, a complete blood count. Others will just look at ferritin, but I do recommend looking at serum iron, ferritin, iron saturation, total binding iron capacity to your
Yeah,
blood. So
absolutely. Get the full panel. And, if you are low and you decide to, increase your intake of foods that are iron rich or take a supplement, maybe get it rechecked in 6 months because then that will guide you, should you continue with what you're doing? Should you maybe adjust it a little bit? So definitely don't just do it once, maybe do it again. And you really have to advocate it. I've come across the same issue where a lot of doctors will, even if it's for thyroid, they'll just check a TSH and they'll say, oh, everything's fine. But you need to go beyond that. You absolutely to pick up, a lot of these conditions, even if they're subclinical, you need to do the full thyroid panel, including the autoantibodies. So really, if your doctor is a little bit hesitant or resistant to order it, really advocate for yourself and try to get these labs done.
definitely agree with you with that. Eye health supplements. So there are a lot of them out there these days,
Yeah.
and I know you're encouraging people to eat, try to get the nutrients you can through food and not rely on supplementation. But when should people consider taking a supplement for eye health, or should they? Maybe you don't think they should. Maybe they should just rely on food or take individual nutrients like resveratrol separately, or some of the other ones that you mentioned separately.
Yeah, well, if we lived in a perfect world, I wish I could say you don't have to take an eye health supplement. But unfortunately, we don't live in a perfect world. And it's been shown, studies have shown that even people on the healthiest of diets are simply not getting enough of these really important eye health nutrients. Like I was talking about the macular carotenoids, for example, lutein. It's estimated that we need about 6.5 milligrams of lutein a day. But unfortunately, most adults probably get only 1 to 2 milligrams a day. So many of us are deficient in these key nutrients, and our macular carotenoid levels decrease as we get older. So it's even more important to supplement, especially when you get into mid-adulthood and later adulthood, to prevent conditions like macular degeneration. So I strongly believe that it is important to supplement even if you think you're eating a very healthy diet, because you need to fill in those gaps. And then the other reason to supplement is, and you may be aware of this as well, Dr. Eric, but our soil is just not as nutrient rich as it used to be. So there are studies that have shown that, comparing soil samples from, let's say, the 1930s or 1940s to more recent years, like 1990s, 2000s, our nutrient levels have significantly been depleted because of agricultural practices, because of tilling, because of fertilizer use. So the soil content, let's take, for example, magnesium or vitamin C levels back in the 1930s, 40s, 50s, used to be much higher than what those levels are in today's soil, which means that our food is also depleted in these micronutrients. So that's another reason why I think we should supplement. I'm actually glad you brought this up, because I'm doing a webinar later today on eye health supplements, and kind of breaking down the science behind supplementation, and what to look for in your ingredients of an eye health supplement, because there are so many brands out there on the market. So if anyone's interested, you can watch the video. It'll be posted to YouTube, so you can watch it at a later date. But in terms of getting a complete supplement, so I actually recommend taking a multivitamin that has all the regular components of a multivitamin. You have your B vitamins, your C, E, D, your minerals like magnesium, selenium, iron, manganese, etc. But also look at the label, and also make sure that in your multi that there's also the bioflavonoids, because not all multis will have the bioflavonoids. So look for that, because then you're getting quercetin, you're getting resveratrol, you're getting some of these other really potent antioxidant nutrients through your multi. And then consider taking a separate eye health supplement that has the macular carotenoids. And then there's another carotenoid that we didn't talk about, which is astaxanthin. And I know that's kind of gaining a lot of recognition recently, because astaxanthin is considered the king of all antioxidants. It comes from algae, this red algae. So astaxanthin is red as well. And basically, it has been shown to help promote skin health, brain health, and also eye health. So in your eye health nutrient, if you're taking a supplement, look for the macular carotenoids, again, lutein, zeaxanthin, mesozeaxanthin, but also look for astaxanthin in that eye health supplement. And then there's some other things you can look for as well. For example, there's a form of vitamin E. Most vitamin E is tocopherol, but there's a specific form of vitamin E called tocotrienol, and that's also considered to be more potent in terms of its antioxidant capability. So if you're getting an eye health supplement, try to find one that also has that tocotrienol vitamin E kind of formulation that is really potent and anti-inflammatory.
So just to summarize, you recommend for pretty much everyone, obviously eat a whole healthy diet consisting of whole healthy foods, but multivitamin with bioflavonoids and a separate eye supplement with the ingredients you just mentioned.
Yeah, and also because we spend so much time on screens, our retinas get a lot of light toxicity from screens, a lot of blue light exposure. So I think it's even more important to supplement with those macular carotenoids. And I even tell, my patients, the parents of my pediatric patients, try to increase your child's intake of some of these foods that have the carotenoids, but also maybe consider giving them an eye health supplement that has lutein and zeaxanthin and mesozeaxanthin, because these nutrients have been shown to help reduce eye strain, digital eye strain, light sensitivity, also help with dry eyes. So you have to kind of think about it in the context of what we're doing in today's age. Is most of us spend the majority of our day in front of a screen. So you want to just be proactive and protect your eyes from any potential adverse effects of screen time. So multiple benefits there, long-term as well as short-term benefits.
Yeah, I'm actually glad you mentioned that, because one of the questions I meant to ask you also is sunlight. Like, how important is it getting sunlight, not just for vitamin D, but just also for eye health? Obviously, you don't want to stare into the sun, but just getting some of those outside rays.
Yeah, it is important because it helps to, especially early morning sunlight exposure, helps to set our circadian rhythms. And our eyes are directly connected to our pineal gland, which is kind of the modulator of our circadian clock. So it is important to get early morning sun exposure. As you mentioned, please don't look directly at the sun. I know some people practice sun gazing, which is not the best thing to do with your eyes open. If you choose to sun gaze, do it with your eyes closed, because those UV rays from the sun can really do a lot of damage to the retina and even cause burns in the retina. So you need to just be very, very careful about that. So again, early morning sun, I would say between 8 a.m. to 10 a.m. is probably best to help set your circadian clock. And again, not direct, like directly staring at the sun. That's not a great idea.
Yeah, but if you're wearing glasses like I do, do you want to take off the glasses again? Not stare into the sun, but is it important to take off your glasses while getting the sun exposure too for
I would
an eye
say
health
yes.
perspective?
Yeah. Yeah, I would say yes, because some people have tints in their glasses that may block out. Let's say you have a blue blocking tint on your glasses. You want to just expose your eyes to natural sunlight, as our ancestors did, hundreds of thousands of years ago. So that's probably the best thing to do. And as you mentioned, there's great benefits for vitamin D production as well. So and mood. There's plenty of studies out there that show that people who get regular sun exposure have better mood, I guess, profiles, you could call them, and less risk for depression or seasonal depression if you're getting that morning sunshine.
And can you talk about some of your favorite therapeutic foods for eye health? I know you also mentioned a bunch of them in your book.
Yeah. So, if I had to think about categories of foods that provide multiple nutrients, the first category I would say would be the leafy greens category. So foods like spinach, kale, collard greens, dandelion greens. These provide high levels of lutein and zeaxanthin, so those macular carotenoids. They also provide vitamin A and vitamin C and some minerals. And iron as well. So a great source of multiple nutrients. Now, I know some people are concerned about oxalates, if they're having leafy greens, especially if you have thyroid issues, you don't want to have too many oxalates in your system. But what I would say is, if you're concerned about oxalates, if you have any symptoms possibly of high oxalate, content in your concentrations in your blood, get your urine tested. And that will really tell you whether you truly have hyperoxaluria, which is the medical term for too much oxalates in your system. So really test to make sure that that's really what the issue is and it's not something else. And then another therapeutic category of foods I would say would be berries, which I talked about earlier. So I typically recommend to my patients to have half a cup to 1 cup of berries a day and try to rotate through those berries, different colors. And you can have them in different ways. You can have them raw, you can have them in a smoothie. There's lots of different ways to enjoy berries. And then the third category of foods I would say that are important are spices. And we haven't talked about this yet, but curcumin, which is the active ingredient in turmeric, the yellow spice, is very anti-inflammatory. It's very potent, and it's been shown in numerous studies to help with autoimmune conditions like rheumatoid arthritis. And there's some early work also with thyroid that it's very, very beneficial. So try to include spices in your diet because it'll help your overall health, help any inflammatory conditions, and also promote your eye health. So curcumin has been shown to help with conditions like dry eye, with inflammation inside the eye, which is a condition called uveitis. And it's also been shown to help with optic nerve function. So lots of great benefits there. Along with curcumin, you may also want to include paprika, which is a great source of lutein and zeaxanthin as well, the macular carotenoids. And if you can, you may even want to include some saffron, because saffron has also been shown to promote macular health. Now, saffron can get a little bit expensive as a spice, but if you have a little bit, you sprinkle it on, let's say, a smoothie or in a soup, it really adds a lot of flavor as well. So it's a great addition to your kitchen.
You mentioned oxalates briefly. Is there any concern with oxalates having harmful effects on the eye, or including any problems with thyroid eye disease patients?
So I haven't seen, a major issue. Everyone, obviously can have, a reaction if you think about it on an individual basis. But I do know that particularly patients who have autoimmune thyroid issues, that there's a study that shows that when they've actually biopsied the thyroid and they found oxalate crystals in the thyroid in individuals with inflammatory autoimmune thyroid conditions. Now, in terms of whether it shows up in the eye, not that I'm aware of. It can show up in the cornea in primary hyperoxaluria, which is more of a genetic issue rather than a dietary issue. So we can actually see oxalate crystals in the cornea in that condition. But again, it's very, very rare to have a genetic condition related to oxalate toxicity. But most people, if you think that it's an acquired condition, first just test. I always go back to that. Just know for sure. And also, there are many foods that have oxalates in them. So not just leafy greens. There's a whole range of foods that have high oxalate content. And if you're really worried about whether you may be sensitive to certain foods or not, you can actually do a food sensitivity test. So not an IgE, which is more of like a food allergy test, but you can do a food sensitivity test where you do a whole panel of different foods and it measures the IgG, your IgG response to those foods. And so that may point out to you which particular foods or food groups you may be sensitive to. And then you can maybe modify your diet based off of that type of a test rather than guessing. A lot of people think they know, but they're not 100% sure. It's always better to actually do the test and to know for sure.
All right. Well, thank you for sharing that, Dr. Rani. And are there any, well, last thing I want to ask you, are there any updates when it comes to thyroid eye disease since you were last on the podcast?
I would say the biggest update has to do with the medication Tepezza, which is teprotumumab. And many of you, if you are following thyroid eye disease in the news, they actually have commercials on TV now for Tepezza. But I think it's really changed the landscape of our treatment for patients with thyroid eye disease, particularly patients who have a lot of bulging of their eyes, which is what we call proptosis, if they have a lot of swelling of their lids, if they have double vision. This drug has really changed how we manage our patients. And initially, the drug was only studied in patients with acute disease, let's say less than 9 months, who had really active proptosis, bulging, a lot of swelling, congestion, and it showed benefit. But now there are studies that show that this drug, Tepezza, can also be used for people with more chronic disease, even up to 10 years in duration. So even after the active phase of the disease kind of calms down, it's really stable, people can still have benefit. And so it's something that is, it's within our armamentarium for treating thyroid eye disease. It's not something that I would rush to immediately, but it's nice to know that yes, there is this option out there. It has been shown to work. It has, yes, some side effects, but overall it's relatively safe. And, it's important to have that discussion with your doctor, particularly your ophthalmologist, your neuro-ophthalmologist, or your oculoplastics doctor about whether Tepezza may be right for you. Now, as an integrative ophthalmologist, I always try to bring both aspects and offer them to patients. So yes, there's that, treatment that's a biologic agent, it's a medical therapy, it's an infusion, but I also combine it with dietary strategies, supplements, lifestyle. So I always try to provide the best of both worlds, not just to say, okay, you're a great candidate for Tepezza, so go ahead and get this infusion for the next 6 months. That's not ideal. You really want to bring more of a holistic approach to thyroid eye disease and use some of these modalities together to get the best outcomes.
All right. Well, thank you so much for sharing that. I know you got to run, but is there anything I should have asked you that I didn't ask you? Anything else you wanted to mention before we wrap things up?
I know we covered a lot, and I know it was a lot to cover in a short amount of time. But if anyone's interested, you can get my book on Amazon. It's available in paperback and in Kindle, and it will soon be available in hardcover as well, and hopefully in the future, audiobook as well. And also, if you want to learn more, I did offer a webinar on my top 4 tips for eye nutrition, and that's also available on YouTube. So you can watch it at your convenience. It's about a 45-minute webinar. And then the webinar I'm going to be doing today on eye supplements, that will also be posted And so you can watch it. Once I have the links, I'll send them to you so you can share them, Dr. Eric.
Yeah,
But thank
please do. Yeah, please do. I'll make sure to include those in the show notes. And what's your website for those who are interested in the New York area who might want to see you in person?
Sure. So my website is my full name. So it's www.rudranibanikmd.com. And I also offer a lot of information on my social media platforms. So I'm on Instagram at dr.rani.banik. And I'm also on Facebook. I have a couple of Facebook groups. So I can share those links with you and your audience as well.
All right, wonderful. Well, thank you so much, Dr. Rani. This was an amazing conversation. And yeah, definitely check out Dr. Rani's book, Beyond Carrots. And
Thank you.
again, yeah, there it is.
Yes.
And yeah, well, thank you again. Thank you again so much for getting together here. And yeah, look forward to, I'm sure I'll have you on the podcast again in the future. But again, thank you for talking about your new book.
It's my pleasure. And thank you so much. And thank you for sharing all your wisdom with your listeners. It's really amazing. Your podcast, I'm sure, has helped so many people. And I look forward to watching you grow and expand your reach as well.
Well, thank you. Thank you so much, Dr. Rani.